Amid this coronavirus outbreak, hospitals are being overwhelmed by the influx of new patients. So many patients, in fact, that some who are less severely ill are being asked to fight the disease at home. But that can have deadly consequences. CNN senior medical correspondent Elizabeth Cohen joining us now with a look at how some hospitals are monitoring patients dealing with this disease while they are at home. Elizabeth, what are they doing?
Fred, this is so important because the sad reality of this outbreak is that not every patient can get a hospital bed. Even patients who are sort of moderately ill sometimes are sent home to recover, and they're told what to look out for, but that is not foolproof. So let's take a look at some really sobering statistics in New York City. What we're told is that in New York City, before coronavirus, about 25 people would die every day at home from various things. But since COVID has been happening, that's more than 200 deaths a day. And officials there, they attribute that, they said, we think this is because of coronavirus. That huge difference is because of people dying of coronavirus at home. So, Fred, there's a hospital in Cleveland, the University Health System, has decided to do something about this. And what they've done is that when they send someone home, when someone comes to the emergency room and they say, we're not going to admit you, we're going to send you home with a device. And so they send them home with a device. And there's a gentleman named Leonardo Frazier, who's a janitor in the Cleveland area. He had COVID. He went home with this device, and it is attached to a central command, and that's the really important part here. This device is digital, and it is attached to, well, I shouldn't say attached, it is monitored digitally, electronically by a central command, and it beeped, and he got a phone call that said, Mr. Frazier, you need to come back into the hospital. He came back in, and he says that this device saved his life. So again, a device that's easy to use, but it is monitored by a central command somewhere.
Wow. So you're a lucky patient if you're at a facility that has that. But, you know, doctors obviously are very concerned about so many other coronavirus patients who are at home. What are their concerns?
Right. So their concerns is that for many viruses, we've seen patients with flu turn on a dime. But for this virus, it seems especially true that people who look like they're okay actually aren't. Things seem to be fine, and then disaster strikes. People get very sick very quickly. And so that's why a lot of doctors are pushing devices like this one so that patients can be monitored at home. We can't monitor everyone in the hospital. It would be great if we could at least electronically monitor people who are at home.
All right, Elizabeth Cohen, thank you so much.
Thanks.